Hello, everybody, and welcome to another episode of Rheumatology in Review. I'm Sam Good, and this is the good stuff. Today, we're going to be talking about differences in side effect profiles for CAR-T patients, comparing lupus patients to those with lymphoma. This study was available online on June 14th of this year in the journal Blood. It's a brief report titled Comparison of the Safety Profile of CD19-targeting CAR-T cell therapy in patients with SLE and B-cell lymphoma. If you've seen any of these videos, you probably know that I have quite an interest in CAR-T, and with good reason. I think it's really one of the more popular and one of the more kind of interesting developments in the field of rheumatology over the past few years, and there's a lot of promise, especially in lupus patients. One of the big questions that remains, however, is how patients will tolerate CAR-T therapy, especially because looking at the history of CAR-T therapy in lymphomas, it has a pretty severe side effect profile. It's a really important question in autoimmune disease because the outcomes in cancer obviously differ quite a bit compared to the outcomes in autoimmune disease. And one of the great challenges of CAR-T in autoimmune disease is selecting which patients should receive this therapy. Again, the really big concern here is that it's a highly toxic therapy, and therefore we really only want to be giving it to patients who both can tolerate it, but also who really need it. There are plenty of lupus patients or scleroderma patients for whom their disease is just not severe enough to warrant potentially very toxic therapy. This study really pushes the field forwards by looking at how patients with SLE tolerate CAR-T cell therapy as compared to patients with lymphoma. A little bit of a spoiler alert here, but in general, lupus patients seem to tolerate CAR-T therapy quite a bit better than patients with lymphoma. So let's get into the actual paper. The article has this very helpful visual abstract that goes along with it, so I strongly recommend you take some time to take a look at it. But really the main question here is, how do patients with B-cell non-Hodgkin lymphomas compare to patients with lupus when it comes to adverse outcomes or side effects from receiving CAR-T therapy? As a little bit of a reminder, the main concerning side effects for CAR-T therapy in lymphoma patients include cytokine release syndrome, that's CRS, ICANS, which is a immune effector cell-associated neurotoxicity syndrome, and ICAHT, which is an immune effector cell-associated hemotoxicity. So that includes things like cytopenias. These are all really serious. They're graded from basically 0, which means not present, all the way up to higher numbers, which indicates more severe disease. But at the severe end of the spectrum, they can be potentially organ or life-threatening. The first point I want to bring attention to for everybody is the frequency of cytokine release syndrome, which is, relatively frequent in these non-Hodgkin lymphoma patients. And CRS goes up to this 3rd degree right here. And you can see that it was present, albeit in a pretty small amount in the lymphoma patients, but not present at all in the lupus patients. And then the more severe disease was, CRS 2nd degree was much higher or much more frequent in the lymphoma patients compared to the lupus patients. And actually the majority of patients who had some amount of cytokine release syndrome in lupus, had relatively mild disease, like grade 1 or none at all. The same can be true for ICANS, the neurotoxicity syndrome, but to an even greater degree. In fact, it was not present at all in the lupus population. Tocilizumab and steroids are used as rescue therapy, specifically for CRS, and you can see it was used much more frequently in the lymphoma patients. The doses of tocilizumab required were higher in the lymphoma patients, and steroid use was also much more prevalent, as was the dose of steroids. They were higher. This is really interesting because another big concern about CAR-T therapy, it's not just the therapy itself, but it's the kind of immunodeficiency that goes along with it, right? In the early days of CAR-T, when you're first getting the therapy, really most of the side effects actually come from the therapy itself, the chemotherapy that you get. And the concern is that it takes time for your immune system to return, and as a result, you're really prone to infections. So the concern is, do these patients with lupus end up getting more infections? That's not evaluated here, but as a way to sort of get at that question, they looked at how quickly CD4 positive T cells and just T cells in general returned in lupus patients compared to the lymphoma patients. And you can see that they return quicker. So the gray lines are actually individual patients, and then the black line is sort of a averaged patient. But you can see that in the lupus patients, this initial line is much steeper, and patients are their T cells are coming back faster. The same can be said for B cells in these patients. So this is probability of B cell reconstitution, and then blue is lupus, and red is the lymphoma patients, and there's quite a difference here. Reconstitution occurs much faster in the lupus population, and really for all the patients, which is not true for the lymphoma patients. As I mentioned in a previous video about CAR-T therapy, there's still a lot of questions that need to be answered, and in particularly, there need to be head-to-head trials for CAR-T cell therapy, but this is another win for the therapy, right? One of the main questions, as I mentioned earlier, was, is this medication going to be tolerated by our patients who, again, have not always, but in a lot of cases, more favorable outcomes than lymphoma patients? This seems to imply, along with kind of a growing body of literature elsewhere, that patients with lupus who receive CAR-T cell therapy tend to have less severe side effect profiles. This was also brought up in a previous video when we talked about this LICAT syndrome, which is sort of like a immune response localized to specific tissue as opposed to a generalized immune response like CRS. And in that paper, the authors also found that while this is a new toxicity syndrome for autoimmune patients, it is nonetheless less severe and typically less organ or life-threatening than some of the toxicities seen for cancer patients who receive this therapy.